Alright. Did you know that 17 days after conception, blood vessels begin to form, and that at day 18, the foundations of the brain, spinal cord, and the nervous system are all laid? Did you know that?
No.
According to the Allen Guttmacher Institute and Family Planning Perspectives, approximately 73% of abortions all happen before the 10th week, and approximately 3,700 abortions are happening every day. And by the 10th week, all of the baby's organs are present, fingernails and fingerprints begin to form. The heart is beating steadily. Do you think that ending a life like this is morally right? I'd like to begin by talking about the developmental stages of baby. I'm going to start with week 3. This is when the blood vessels begin to form, and you can see the little baby right there forming. The foundations of the brain, spinal cord, and nervous system are laid. The heart begins to beat. The eyes begin to develop. And the earliest stages of life are present. Okay, so you can see the little baby there. All right, and this is at week 4. This is when the lungs begin to form. And 2 tiny arms and legs begin to bud. This is at week 5. The nose starts to develop, the thyroid gland begins to grow, and blood flows through the baby's veins. This is also when the eyes start to develop. This is at week 6. This is when the baby can make the first reflex movements. And the fingers and toes begin to form and joints begin to form. And this is also when the brain is divided into 3 parts. And this is at week 7. You can see the eyes forming really well, and the hands and legs starting to form. This is when the facial muscles really start to develop, and the eyelids form, the elbows take shape, internal organs are all present but immature. 99% of muscles are present, and you can actually record electrical activity in the brain at only 7 weeks. At week 8, this is when spontaneous movement begins, but the mother doesn't really feel anything yet. And they're usually well proportioned and about the size of a thumb. You can kind of see there, that's baby at week 8. You can see them developing. And then pretty much through weeks 9 through 15, this is when the fingerprints and the fingernails begin to develop. The baby can now urinate. Stomach muscles can now contract. Vocal cords and taste buds are also forming during this time. And it can respond to skin stimulation. But yet the mother still can't really feel anything yet. And then this is at week 16, just to give you an idea of how it progresses. And that's at week 26, they're getting kind of crammed in there. At week 36, this is when they start to really just keep putting on the fat and keep growing just a little bit more before they are born. The most common types of surgical abortions are performed in the first trimester, and they are suction aspiration, and dilation, and curettage, which is also called D&C. And this is the suction aspiration, and this is usually when they give local or general anesthesia, and it can be given to the mother's cervix, so it can quickly be dilated. And the suction curette is a hollow tube. You can kind of see the hollow tube there, the curette, and the knife edge tip inserted into the womb. You can see where it's right down the edge. The instrument is then connected to a vacuum machine, and the vacuum machine is actually 29 times stronger than a home vacuum, so it's really strong. And it basically tears the baby apart and sucks it out, and they dispose of it. And the D&C is pretty much similar to that, except that they have a hook-shaped little thing at the end of it that cuts the baby into pieces, and they remove it that way. Some of the latest things, which aren't really approved by the Drug and Food Administration, is the RU486, and it's used to induce abortion with women who are 5 to 9 weeks along, and it requires actually 3 trips. They say this is kind of the easy way out, but it actually requires 3 trips to go back and forth to the clinic because of the severe side effects. You have to be closely monitored, It can cause severe bleeding, nausea, vomiting, pain, and in some cases has even caused death. And then there's another type of chemical abortion. It's called methotrexate, and it's a prescription drug, and it's usually used to treat really life-threatening tumors and also used to treat autoimmune diseases. And the drug also has really high side effects due to its high toxicity, and it can include nausea, diarrhea, severe bleeding, liver damage, and even lung damage. And there are also many side effects that are caused from abortion. That can include bladder and bowel injury. Because they're in there kind of poking away, they can accidentally poke either your bladder or your bowel or many other things. And you can have fever, you can have inflammation, and if not treated quickly, it can result in death. And you might actually even need surgery to repair the injured tissues. And then you can also have hemorrhage, hepatitis, and infection. Up to 14% of women actually need a transfusion because of the severe bleeding that occurs. And hepatitis can occur because of that transfusion. And also infection is likely in 1 out of 4 women who get an abortion. There are also many side effects on future pregnancies. You're more likely to bleed in the first 3 months. You are more likely to not have a normal delivery. You will need manual removal of the placenta, and also have many complications expelling the baby's placenta. Your next baby is actually twice as likely to die in the first few months. You'll be 3 to 4 times as likely to die in the last few months. So actually, as the baby progresses more, their chances get higher and higher. And the baby can also have a low birth weight, and it also more likely that they will be born prematurely. And then women also can suffer from what is called post-abortion syndrome, and they can suffer from a big range of medical and psychological problems. They can include recurrent dreams about the abortion, avoidance of emotional attachment, relationship problems, sleeping problems, guilt, depression, all sorts of things like that. Many women who go through an abortion are devastated by it afterwards. I'm going to also go over some statistics about abortion. And this is kind of what these 2 charts are here. In the U.S. alone, nearly 1.37 million women have abortions each year. And like I said earlier, approximately 3,700 a day. 65% of abortions are performed in never married women. Married women account for 18%, and divorced women account for 9%. And then 1% of abortions occur because of rape or incest, and 6% occur of potential health problems, and then the rest, 93%, occur just for social reasons. The baby's unwanted or is basically inconvenient at the time. And 78% of abortions occur before the 10th week, and that's what this is showing right here. It's showing up to 21 weeks plus. And this big section right here is all before 9 weeks, and then that's before 9 and 10 weeks. So the majority of them do occur before 9 and 10 weeks, but like we were talking about earlier, all those things are pretty much developed and the baby's already starting to form. And then this is just the distribution by race. And the yellow is black women, the purple is non-Hispanic or white, the green is Hispanic, and the orangey color is other. Now, just with the fast development of baby, do you think that it's really right to get rid of baby like that? With all the possible side effects, is it worth the risk? Personally, I think that 1.37 million deaths is way too many. And I think that abortion is morally wrong, and I think that people should really think about the other options that they have. I personally know someone who had an abortion, and I know how devastating that it can be. And it was really devastating for her. She can't go a day without thinking about the baby, and she wishes that she would have never done it. She has nightmares every night, and she's clinically depressed because of it. And if she would have known of more options like adoption and stuff, she thinks now that she would have definitely gone back and changed and done things differently. Now, I just want to give you a scenario. If you were put in that situation, what would you do? And I hope with everything that you learned today that you will choose a different option and not be included in those 3,700 babies that are aborted each day. Thank you.